Supervision. This training is part of the Open Doors Peer Training Series. In this training, we will discuss the following topics: how supervisors work with transition specialists, training opportunities for peer supervisors, what peer supervisors need to do when their center hires a peer advocate, the training that new peer advocates need to complete, ensuring timely and accurate database and documentation, health precautions, and benchmarks. ILCs select the peer supervisor. Every independent living center designates one or two peer supervisors for the peer program. Our work is guided by the Open Doors database, and so it is not uncommon for you to hear either primary supervisor or secondary supervisor. That's database terminology for how you as a user of the database are designated. So again, centers are able to appoint one or two peer supervisors, and then we at NIL, the New York Association on Independent Living, receive that information from the Independent Living Center, and then we can create you an account that will allow you to access our web-based Open Doors database. Supporting peer advocates. As the peer supervisor, you are responsible for making sure that your peers meet with participants within 10 days of receiving a referral. And to do this, you will provide support and supervision to the peer advocates at your center. It's important to note that as a workforce development initiative, some peer advocates will need additional coaching to be successful in their role. And some peer advocates are successful because they receive support from a job coach. If you are not familiar with job coaches, or if you notice that a peer advocate might need remedial skills in a particular area, talk with somebody at your center who is familiar with workforce development so that that peer advocate can be connected to the employment supports that will help them be successful in this role. Additionally, supervisors will assist peer advocates with professionalism, documenting all work provided through Open Doors in our database, workforce and skill development, problem solving, and arranging transportation. We speak more about the professionalism and problem-solving skills required in the role of the peer advocate. But peer advocates should wear, at the very minimum, an open doors shirt, which can be obtained from NIL by emailing the peer program with the peer advocate size and address. It's important for peer advocates to understand that their behavior not only reflects them personally, but it's also representative of Open Doors, the Independent Living Center, and the broader movement to transition people out of nursing homes across the state. As supervisors, we want to empower peer advocates to actively solve problems that they might encounter, such as not being able to get a hold of somebody in a nursing facility when they get there to visit. So proactively instructing them to call the nursing home in advance to confirm the appointment so that a trip isn't wasted. Or problem solving around a particular question that the participant asks them. And rather than making up an answer or avoiding the issue entirely, learning how to think critically and seek assistance from a transition specialist or other trusted staff member at the Independent Living Center or broader community. So you're really going to want to convey these problem-solving skills while also saying that asking questions is okay. Database and documentation, you can refer to our training under the same title, and we'll discuss some of the database and documentation expectations later in this training. But you're going to want to make sure that peer advocates document all contacts with participants and anyone else who they contact in the database, document all outreach, and document all trainings, as well as document their flu status. And we'll speak more about the flu vaccination and mask wearing requirements. There are instances when the peer supervisor will be expected to arrange transportation for the peer. You might have to do this if the peer has limited resources and is unable to front the money that is required. Other centers and peer supervisors have a system in place so that the peer advocates don't have to pay upfront for transportation, and it's arranged through the center. And you might also have to arrange transportation because of logistical challenges associated with that peer advocate's disability. So in other words, a disability might make it difficult for that peer advocate to arrange his or her own transportation. And so a reasonable accommodation that is provided is that the peer supervisor arranges the transportation to and from the nursing facility. Working with transition specialists. The peer supervisor works with transition specialists to identify participants for peer services. Peer advocates receive referrals for peer services in a few different ways. The primary way that peer advocates receive referrals for peer services are from transition specialists from within that center or region who talk with a participant who states he or she is interested in receiving peer services. As the peer supervisor, it is your responsibility to communicate that referral to the peer advocate and to ensure that that visit occurs within 10 business days of receiving the referral. In the database, you are responsible for assigning the peer advocate, and we'll discuss that a bit later. And then you are also responsible for ensuring that the peer advocate completes the visit and then documents it in a contact note. Another way that peer advocates receive referrals, and this is a less common way, are through the relationships that peer advocates build at nursing facilities. For instance, Brian is visiting with John, and the people who live on John's floor frequently see Brian coming into the nursing facility and take interest. And it is through that method that a referral for transition services is made. The peer advocate will complete a new referral in the database, and then the peer supervisor can make sure that the transition center is aware that a new referral was made. The peer program is only as successful as its relationship with transition specialists. So the overarching goal of the peer supervisor is to promote that dialogue between the transition specialists and the peer advocates so that transition specialists regularly make referrals for peer services. Peer supervisors are going to run into peer advocates who are looking for work. And again, peer advocates can only work as much as they have referrals. So the proactive peer supervisor will be working with transition specialists to make sure that transition specialists are promoting the peer program, generating referrals for peer services, and then connecting peer advocates with participants who are interested in peer services. Training opportunities. Part of Open Doors is creating learning and networking opportunities for all of the staff. As a peer supervisor, there are 2 mandatory calls that you will need to participate in. We have a monthly statewide peer supervisor call, which convenes peer supervisors from all the participating independent living centers. And the monthly peer supervisor call is an opportunity for peer supervisors to hear new program information, but also to provide support to one another around best practices or areas that need improvement. These calls are generally under an hour. We also schedule monthly technical assistance and support calls, more commonly referred to as tech calls. And during this call, you'll be working with peer program staff. You will be assigned a liaison at the New York Association on Independent Living. And that's the opportunity for you to ask any questions that you might have, troubleshoot any issues that might arise. Open Doors peer program staff will review peer advocate caseloads with you, will review budget expenditures to make sure that spending is in line with deliverables, which we'll talk about later in benchmarks. But there are two mandatory calls a month, which take less than 2 hours total. Additional training and learning opportunities include statewide conference calls, which convene transition specialists, peer advocates, peer supervisors, regional leads, all on phone or video at once to hear the latest program updates. The frequency of these changes from time to time, but you will be notified if there's a statewide conference call. NIAL convenes annual regional trainings. New York State, for Open Doors, is divided into 9 regions. And the regions follow the New York State Department of Health regions. And so at the regional trainings, peer advocates, transition specialists, peer supervisors, other independent living center staff, as well as staff from Rapid Transition Housing, RTH, and Olmsted Housing Subsidy, OHS, come to either an in-person or virtual event to build skills, connect with other staff in their region, and learn best practices. We convene an annual statewide Peer Leadership Institute, either in person or online. The statewide Peer Leadership Institute is for peer supervisors and peer advocates, and it's a unique educational opportunity that allows the sharing of information, enables peer advocates and peer supervisors to provide mutual support to one another, and also realize that they are part of a broader network for systems change. And we also convene a biannual conference. And the biannual conference is the New York Association on Independent Living statewide conference that is held every 2 years. New hires. As centers hire new peer advocates, we need to be apprised of the following: the peer advocate's first and last name, whether they are a DOH, OPWDD, veteran, family, or elderly peer advocate, and their email address. You can send this information to your liaison at NIL. We need that information so that we can create an account for them in the database and ensure that we have the appropriate documentation to get them started as a new peer advocate. Database and documentation. This is where you log in. In this slide, you're seeing the different screens and tabs in the database. Your dashboard, find clients, organizations, my profile, the different reports that are available, and the different resources available. If you click Manage on the dashboard next to a participant's name, you'll be able to see all of the information from the different programs. Here are the contact notes page. You have the ability to add a new record for the peer program. It would either be peer or peer discharge follow-up. The note that the encounter or the conversation occurred. Pressing View allows you to review the note. Open Doors Status tells you the participant's status in the Open Doors program. The peer supervisor will ensure that all new peer advocates complete the required training. The trainings are in the database, and to access the database, the peer advocate will need to use the username and password sent by the database to them. New peer advocates need to complete the Open Doors peer training series before they can provide peer services or conduct outreach. The training for peer advocates is 8 hours, and it's a web-based training. Peer advocates need to document completion of each training, and the supervisor will need to check to ensure that the trainings are accurately documented in the database. The next video will show how to access the trainings from the dashboard. Go to Resources and select Peer Training. Enter and save the training. You go to My Profile and select Training History. Click the blue button that says Add New Record. For event, you will select the name of the event if it's listed there. An event just means training. For training type, select peer training. Date completed, enter the date it was completed. Select yes for billable peer contact. Enter the amount of time it took to complete. And press save. When you see that save box, that indicates that the training has been saved. As the peer supervisor, it's your job to ensure timely and accurate documentation of peer services, outreach, and trainings. You should review this information often, and at a minimum, at least monthly. Open Doors program staff review the data, and then we send a spreadsheet of corrections. And the peer supervisors are expected to make sure that the corrections are made to the data. There are reports in the database that can assist you to proactively identify missing information or incorrect information. The next video will show you how to assign participants to peer advocates. On the dashboard, click Assign, and then hit the Peer Specialist pull down and select the name of the peer advocate. The peer advocate will then receive an email saying that they have been assigned a client. Transition specialists, RTH and OHS housing specialists will also receive an email whenever the assigned field is updated in the database. Some peer supervisors will also assign themselves as the secondary peer so that they can get to that participant's information rather than having to log out of their account and log into the peer advocate's account. When you receive a new referral for peer services, be sure to let Open Doors peer program staff know. And when a participant is no longer receiving peer services, let Open Doors peer program staff know. As previously stated, you can use reports generated by the database to enhance the supervision of the peer advocates. This next video will demonstrate. On the main screen, go to Reports and then Peer Reports. There's a peer voucher, an Invoices tab, peer face sheet search, the peer census, the peer staff report, peer missing data, and peer supervisory report. There will be times where you will need to press the Notify Admin button. The Notify Admin button then gives you a box where you can select different choices, but you're going to use this box if you want to notify staff at the New York Association on Independent Living about something, if you want to make a referral for transition services, if you want to notify the housing programs. This next video will demonstrate. Next to the participant's name, click Notify Admin. You can select Transition Services Staff, Peer Director, Referral for Peer Services, Transition Specialist Regional Lead, Housing Regional Lead, or Housing Administrator. There's then a message box, and then press Submit, and it's sent. This next video will show the referral source. Next to the participant's name, click Manage. And then the little pencil next to Open Doors Status. Under Peer Services, Source of Referral, click the source of referral. When you receive notification that a participant is interested in peer services, you'll use that field in Open Doors Status to document where the referral came from. Health precautions. Every year, peer advocates will need to provide documentation that they received the flu shot, or they will need to sign the declination of influenza vaccination and agree to wear a mask when in an institutional setting. This also applies to peer supervisors if they are providing peer services. As the peer supervisor, you are responsible for uploading the influenza status documents for peer advocates and peer supervisors to the database. This is a task that might put you in contact with the Open Doors program nurse. The Open Doors program nurse ensures compliance with health precautions in addition to other tasks. Peer supervisors will also ensure that peer advocates comply with all applicable Department of Health, Independent Living Center, and institutional directives for scheduling visits, ensuring physical distancing, mask wearing, and PPE. Questions or concerns can be directed to the New York Association on Independent Living. The next video will show you how to upload flu vaccine or declination of influenza vaccination documents. Go to My Profile, click on Immunization Records, then Add New Record. Select the immunization year, which is this year. Enter the date that's on the flu shot or the document. Then select Browse, and then upload the document. Press Save. You will see a box saying that it was uploaded and saved successfully. Benchmarks. It is the peer supervisor's responsibility to ensure that their center meets the minimum number of visits established by the Open Doors peer program. Each center has a predetermined number of visits, and these are total visits, not visits to unique participants, that they must meet over the course of the year. The New York Association on Independent Living, in its regular meetings and conversations with the peer supervisors, will review progress toward the deliverables. And so as the peer supervisor, you need to be able to make sure that peer advocates are consistently providing peer services on a trajectory that will meet and preferably exceed the established visit threshold. If you don't know what the minimum number of visits are for your center, reach out to the New York Association on Independent Living. You can monitor progress by reviewing the reports under the peer report section. In this training, we talked about the following. 1 or 2 staff members are designated by the Independent Living Center as the peer supervisors. Peer supervisors provide support and supervision to peer advocates. Supervisors assist peer advocates with professionalism, problem solving, documentation, and arranging transportation. Supervisors work with transition specialists to identify participants for peer services. Supervisors participate in learning and networking opportunities. Supervisors communicate new hires to the New York Association on Independent Living. Supervisors ensure new hires complete the required trainings. Supervisors ensure peer advocates participate in the regional trainings and apply to participate in the statewide Peer Leadership Institute. Peer supervisors ensure timely and accurate documentation of peer services, outreach, and training, and review that data and documentation for accuracy and make changes at least monthly. Supervisors ensure compliance with influenza documentation and other health precautions. If you have any questions about your role as a supervisor, contact the New York Association on Independent Living. This concludes the supervision training. This is part of the Open Doors Peer Training Series.